Hey y'all, my name is Abby Allen, and today I'm going to be informing y'all on the PANDAS disorder. And you might think that I'm talking about an animal just because it's spelled like panda, but it's actually a neurological disorder that's associated with strep. So according to the National Institute of National Health, symptoms can happen overnight. It just doesn't just come in, it's out of the blue. And children can become irritable and moody with a mix of anxiety attacks. So a child can flare off of another individual if they're starting to get sick and potentially have strep. So the person that's diagnosed with this disorder, they would start noticing if someone was starting to get sick before they would even know that they're sick. What are the steps of diagnosing someone with PANDAS? Unfortunately, there's not much you can do with labs just because you aren't able to see a lot of lab work in everything. So certain criteria is monitored to determine further steps, like it's a certain regimen and you have to monitor everything to diagnose someone with PANDAS. There has to be a presence of different symptoms such as anxiety episodes, OCD, and neurological abnormalities. So these symptoms, they're from the International OCD Foundation, and it's severe separation anxiety. Like my brother, he's diagnosed with PANDAS. So whenever he would go into school, they would have trouble trying to get him in the car or out of the car to go into school, and just it was a lot of work for him to build up to be able to go into school and not have any anxiety attacks. Another symptom is anorexia or an eating disorder. My brother's actually really small for his age, so he doesn't eat as much as the normal teenager. Acute handwriting difficulty, mood changes such as sadness, unstable emotion. They go from happy to sad and within a short period of time. Trouble sleeping and joint pains. So it is often that there's a combination of the symptoms to run the source of diagnosing someone with PANDAS, just because if you have just joint pains, it's not normal that you would have PANDAS. So for treatment, the medical news today states that there are different strategies that you can take to help with the issue. That they say that medication is most effective, and it is normal that doctors usually start out with the lowest dosage and then build their way up, or if it's too much, they'll knock it down if it's playing with their head or anything. Other sources can be used to play an effect in getting the patient better and stable, such as therapy, family support, and also one-on-one care with the family and with the therapist. My little brother, he has to go to therapy almost every single month just to make sure he's in the right course, and also in schools. He has one-on-one therapy while their other kids are taking tests. He has to go in a certain room to take tests, and there's just a bunch of other stuff that go into play with it. What is the estimated time span with the PANDAS diagnosis? So doctors and neurologists put a lot of effort and time when diagnosing someone with PANDAS. Everything does not come overnight, and there's a trial and error process, and that's a little bit about PANDAS.